Welcome to the Catalyst Podcast, brought to you by Chestnut Health Systems. I'm your host, Charles Epstein. 2026 marks the 40th year anniversary of the Lighthouse Institute. And today we're speaking with someone who was there from the very beginning, Dr. Mark Godley. Mark, welcome.
Thanks, Charles. It's good to be here with you today, and I'm excited to talk about some of the early days of the Lighthouse Institute.
Yeah, the pioneer days,
Yeah,
covered
believe
wagons and all this stuff.
so to speak. It
Yes,
almost
yes.
seems that way, but as long ago as it was, I wasn't the first one there, but I got there as soon as I could.
Ah, excellent. So, yes, you're here to tell that story, and
Yeah.
I've been looking forward to this conversation. Mark, just a brief background on Dr. Godley, if I may. Dr. Mark Godley's career in the addiction treatment field spans more than 50 years. He was the first director of Chestnut Health Systems Lighthouse Institute for Research and Training and a senior scientist from 1987 to 2014. Prior to joining Chestnut, he served as a clinician and clinical program director of a community-based addiction treatment program in Southern Illinois for 12 years. Dr. Godley is now semi-retired, which means he's still taking on projects, but is now at the stage of life where he balances it with tending the garden, taking nature walks, and spending time with the grandkids. So you've been with the Institute way back, as we said, it's pioneer days, but more seriously, days when it was bootstrapping its way from a startup with few prospects to what it's become today, which is to say a first-class research institute. Obviously, you're here to tell this story. Before you take us back to the beginning, as I mentioned in your intro, at the time you'd been a clinician and clinical program director for 12 years. What prompted you to join Lighthouse, particularly at that very embryonic stage in its existence?
Yeah, I had been a clinical program director, as you mentioned, in addiction treatment for a number of years. And through that period of time, I also pursued doctoral level studies at Southern Illinois University in Carbondale and specializing in research and evaluation, methodology, and I was ready to begin to apply that degree to another calling, and that calling was program evaluation and research. And I was eager to do that. In fact, I had interviewed for jobs at my alma mater in their alcohol and substance abuse counselor training program. We had gotten very close to an agreement, but then it sort of fell apart based on some different considerations. I had also kind of serendipitously, the state of Illinois had passed legislation to create an addiction research institute that would be based in Chicago, and I had put my CV in for that as well, and that didn't work out either. So I was out kind of looking for work that could further my career in research and evaluation. And what happened along the way is that a colleague of mine who happened to be the CEO at Chestnut Health Systems, his name is Russ Hagen, reached out to me and said, I hear you have your PhD now and you're looking for a research position. I know you know Bill White, who came back to Chestnut and has started the Lighthouse Institute well, at that time it was called the Lighthouse Training Institute. And I wonder if you'd be interested in talking about that. And, I was flattered. I was over the moon, and we just started meeting. And because we served on a board of directors for our statewide association in addiction treatment and prevention, we would meet up at various meetings and train stations, airports, and so on, and start talking about the position. And over the course of about a 6-month period, we had pretty substantial agreement on what that could look like. And I was, of course, thrilled to have the opportunity to be joining Bill as well, who I already knew, not well, but I'd been to some of his trainings and had some conversations with him. So yeah, I was just so grateful for the opportunity to speak. And if I can carry the story on just a little more, Russ had me come up to meet with the board of directors, kind of an audition, if you will, at Chestnut. And but it seemed to go well enough, and that was in late 1986.
Mm.
And on April Fool's Day of 1987, I had my first day at Chestnut Health Systems. And
Excellent. So not exactly a straight path, a little bit winding, but you got there
yeah,
nonetheless. So let me ask you something because we mentioned the early bootstrapping days. So sometimes you take on work that may be a little bit far afield from what you signed on to do. Could you share with our listeners what one piece of work came in over the transom that you simply could not turn down because you had to keep the lights on?
yeah, I will share. There's actually a couple that I'd like to share, but I just have one more quick kind of transition to get to
Sure.
that story that happened on my first day at the Institute. Bill White and I had a meeting. Bill was there. His title was Director of Training and Consultation. My title was Director of Research and Evaluation. We were both directors of something, and we had a halftime person between us to provide support. So that was just he and me and our assistant. And he, in the very first meeting we had, he turned to me and he said, "Mark, I want to train, I want to write, I don't want to run an institute. So I want you to do it if you will." And I felt like it was the least I could agree to because I'd already been sort of operating and managing treatment programs with lots of staff. And so I thought, well, what's there to manage?
Right.
Little did I know. So I said I agreed to that and I became the de facto director from day one. That title was formalized a few years later. But as you mentioned, we were bootstrapping our way to become an institute. And in those early days, the opportunities were sparse and we were struggling. I think our first year annual revenue was just over $40,000, and that wouldn't pay for one salary and fringe, much less two. So how we were going to justify our existence to the board was a matter of concern. And we were trying, we were putting in applications for different things. And one thing that fell across our desk was a colleague of ours had an serious amateur interest in photography, and he was approached by a 1 hour photo development company, and this is back before digital photography, to develop a manual for developing 1 hour photographs. And we were like, well, we got to do something to keep the lights on. Let's take that on. So we took that on, and oddly enough, they went bankrupt, never paid us. So that fell through. About 18 months in to my employment with the organization, I was pretty despondent, bordering on sort of a depression that things were not gelling. And I can remember going to my boss, Russ Hagen, at one point and saying to him, look, this may not be working out, certainly not as you and the board had hoped. Is there anything I can do to help out in other areas of the company to at least justify my existence? And Russ did not hesitate. He just said, let's give it a little more time. And that support meant the world. And,
So when did you turn the corner?
it was about 6 months later. And we didn't turn the corner running. We turned the corner slowly. Things came in that were still not really in our wheelhouse of what we wanted to do. But for example, one thing that came in was an opportunity based on my prior relationships with the state of Illinois in the southern part of the state to an opportunity to provide management services to an addiction prevention and treatment company that was floundering. They didn't have good executive management and they needed help. And somebody from the state had referred them to me. And I talked to Russ about it, and we decided we would take it on. And it allowed me to hire one of our staff at Chestnut who could go in and manage it and report to me and help out. And interestingly enough, that 2-year contract ended up turning into a merger that company ended up coming into Chestnut, and it opened the gateway for services in the southern part of the state that Chestnut still operates today. So that was kind
Well,
of kind of an interesting kind of
yeah.
sidebar that happened and
So,
resulted in.
so, so speaking of that other entity coming into
Yeah.
Chestnut, it begs the question, how did it come to be that a research institute became part of a community-based health organization? I don't think you see that marriage too often. So how did that come about?
Yeah, that's a story too. I'm going to take you back to 1973, and that's when the predecessor company to Chestnut, which they changed their name to Chestnut, was formed. And my colleague, whom you've interviewed before, and we all know Bill White, and a couple of other dedicated souls started Chestnut Health Systems. They hired a guy to work in the detox program, and his name was Russ Hagen. So Russ reported to Bill. Years later, Bill left Chestnut to go off and do other things at NIDA and with the Dangerous Drugs Commission in Illinois. And he ended up in Decatur working at running a treatment program. Well, Bill had taken this idea of starting a training and research institute to Decatur Hospital, but they couldn't see doing it. They couldn't see doing it. So they moved on, and Russ and he talked, and they became very interested in forming a partnership, and that started the Lighthouse Institute. And so it was the vision of those two and the support of a board of directors who was willing to do a moonshot.
Yeah, no, amazing, and quite a good roll of the dice. Look
Yeah,
at what
yeah,
happened. Yeah,
it
amazing.
worked out. If I might add that today the institute has gone, well, it's gone from less than 1% of Chestnut's total revenue to almost 20% of Chestnut's total revenue. So it's a significant part of the organization. And there are 85 research staff and training staff spread out through the United States, mostly concentrated in Illinois and Oregon. And Mike Dennis, Dr. Dennis is now the Chief Research Officer for Chestnut Health Systems, and Dr. Lisa Saldana is now the Director of the Lighthouse Institute.
What would you say are the most significant milestones since you've been with the organization?
Yeah, so we really were bootstrapping our way through to get to program evaluation contracts where we were helping other organizations who had won these federal demonstration grants to evaluate their services. Once we started taking on more and more program evaluation work, it became clear that we needed help. We just didn't have the scientific expertise necessary to get it all done and to get it done in a timely fashion. At that time, my wife, Dr. Susan Harrington Godley, was also working in a program evaluation practice with the state and with county governments to help develop and evaluate programs. And she was gracious enough to come on board with us as a consultant at first to help us solve some of the thornier program evaluation issues that we were experiencing with some new projects. From there, she went on to become a senior scientist with Lighthouse Institute and really embodied the potential of the institute to create research and practice partnerships within Chestnut Health Systems. So she sort of brought our research expertise to our clinical teams in the more the practice-oriented divisions of Chestnut by winning several federal grants that help them develop services while allowing us to conduct research as well. And the one that is really most notable is that she led the development of the evidence-based practice now known as the adolescent community reinforcement approach. She conducted the initial clinical trials that led to really wide scale application of that model in adolescent treatment that's now in more than 40 states in the United States and several Canadian provinces. So that's just want to recognize those contributions
Sure.
yeah.
Any other milestones that come to mind?
One of the milestones there is we won a program evaluation contract that was significant in scope and size. It was called Target Chicago, and it was to develop a central intake. We didn't develop it, but local providers in Chicago developed it, and we were the evaluators of it. Well, one of the things we had to do was to follow up patients going through that central intake for up to a year. And we knew, first of all, we had no presence in Chicago. And secondly, we didn't really know how to do client follow up. This would have been 1993 and 94. And I hired Dr. Chris Scott to come in and open our Chicago office. And I linked her up with a research scientist down in St. Louis who was doing work with homeless addicted population in St. Louis and following them up. And I sent Chris down to meet with Dr. Smith in St. Louis, and apparently it was a very good meeting. Chris came back, stopped by at my office to talk to me about it on her way back to Chicago. And she said, "Well, Mark, it's very simple how we're going to do client follow up. We're never going to lose people." I was like, "Oh, great. Okay. It's that simple and it's that complicated all at once." But
Sure.
she developed a protocol to do it and they managed it. And Charles, they spun that project into a 19-year client follow-up by braiding funding from multiple different sources to keep that work going. She and Mike Dennis supported that work for almost 20 years, and that's a pretty amazing feat, and they published widely on that. So that's one of the milestones that helped us turn the corner. It opened our Chicago office. It taught us how to do longitudinal client follow-up, which we then were able to use in all of our future studies. Another really significant milestone for us was a retreat that we held in 1994. It was the actual first retreat we ever had, and I never conducted another one after that. Not to say some of our program staff didn't do them, but that retreat helped us turn the corner from program evaluation into the area of investigator-initiated research, where we would apply for funding from the National Institutes of Health in order to conduct research on treatments that we were working on and developing, and they would fund clinical trials work. It took us 3 years to get from our initial applications to success. And as things go, when it rains, it pours. And in 1997, we hit not one but three grants, and then
Wow.
we had to figure out how to put foundations under all of those to make them work.
In other words, in 94, when you went to this retreat, the idea emerged
Yeah.
from that.
Well,
It took you three
we took the
years.
idea into the retreat, and what we were doing was building consensus among our senior people for what will be our research themes. And our research themes were adolescent treatment, continuing care, which then morphed into long-term recovery monitoring and support for patients. And those became our major themes. When Mike Dennis joined us to help us with our methodology, we that helped us win those NIH grants, we also took on another theme of broad spectrum or biopsychosocial assessment. And Mike brought that expertise to our work. So
Mm.
yeah, those became our research themes. And if I may, one other milestone was that Bill White, my partner and from day one, decided that he really wanted to back out of training. It was laborious, it was stressful, it was a lot of time on the road, and he was looking forward to writing and doing research. In 1998 or so, he started a partnership with a colleague of ours named Mike Boyle that resulted in looking at applying disease management principles to addiction recovery. And Mike wanted to call it Mike got funding for it and wanted to name it the Behavioral Health Disease Management Center. And Bill said, let's call it Behavioral Health Recovery Management, because that is so much more positive and so much more oriented toward what long-term addiction recovery should be. Positive support going forward, building recovery capital so that your life becomes so much more fulfilling. And Mike said, Bill, that sounds good to name it that, but will anybody know what it was or what it is? And Bill said, they will in 3 years. And Bill was as good as his word. That happened. He was a prolific and continues to be a prolific writer on recovery. I just parenthetically, I submitted this kind of query to my AI client, and I asked it, how often, what were the number of mentions of recovery in peer-reviewed scientific articles prior to the year 2000 versus 2000 to present? And they said there's no comparison. The the use of recovery in the literature increased exponentially. And that's largely due to the writings of Bill White and a few other folks who he's worked with. So it's an amazing story and one that we're immensely proud of at the Institute.
Justifiably. Mark, as we said at the outset, you were semi-retired, but you still take on projects. What makes you excited about this work, having been in the field for as long as you have? What keeps you engaged and makes you excited?
Always it's discovery. The research is about discovery, and discoveries we've made in the past have led to remarkable changes, particularly in the area of adolescent treatment. Prior to, say, when we started doing research in the late 1990s on adolescent treatment, it was dominated by adult models that were really confrontationally based, models where you had to confront denial, and those models just didn't align well with adolescent development. So they were not really good for the field of adolescent treatment. Our work and the work of some of our colleagues around the country really helped create a sea change in how adolescent treatment is done. And it's much more supportive. It's much more rolling with the resistance that adolescents are normally going to pose anyway, but working toward developing recovery support and recovery capital for them over time. So that's amazing. And I love working on that. And we're still doing projects right now. I'm talking to a research group at Chestnut where we're working on creating peer mentors or peer support specialists who are slightly older than the adolescents, like they're young adults in college who are in recovery. And Our colleagues at Chestnut and at Boston University are working on a proposal right now to pair them up with adolescents in treatment so they can provide ongoing support, recovery support to them for like 12 months after they leave treatment. So that's a really fun project to work on.
That sounds great, and I really do appreciate your spending this time. You were there at the beginning, at the creation, and it's an amazing story, and you tell it amazingly well. And as you mentioned at one point, you're very proud of several of these milestones, as well you should be, because it really is amazing from such, I guess I'll use the word humble beginnings to what you've built today. So kudos, Mark. Thanks so much for telling this story.
Thank you, Charles.
Today I spoke with Mark Godley, who was there at the creation of the Lighthouse Institute, and he was here to tell us that remarkable story. This is Charles Epstein for the Catalyst Podcast, brought to you by Chestnut Health Systems. For more, visit www.chestnut.org. Thanks for listening. See you next time.